Hi, I'm Paul Colosky, physical therapist and owner of Vallejo Physical Therapy here at 1235 Clear Lake City Boulevard. We're located in Suite F. We've been open since September 2007. And additionally, I'm a certified athletic trainer as well as a certified strength and conditioning specialist. We began using the low-level laser in about 6 months after that time period. I had a couple of cases that were beginning to be a little bit more challenging. One particular case was a client that we had that was suffering from what ultimately turned out to be just foot pain that he was having, a referral, trigger point referral pain in his foot that actually resulted in, or he had actually asked for the physician to amputate his second toe because of the amount of pain that he was having in that area. We saw the patient about 6 months after that amputation. He came in, we were doing a lot of the traditional physical therapy or physical medicine modalities, a little bit of the E-stem work, a little bit of the ultrasound work. After about 6 sessions, I got a little frustrated with the case, called my supplier and said, hey, I wanted some more information on low-level laser. We had been introduced to it very briefly when I was in physical therapy school, and so I didn't know much more about it after that. So I called him up and said, hey, Frank, can you help me out with what this stuff's about? At that point, he said, yeah, Paul, you know what, let me make a phone call. And about 2 days later, I was introduced to Mike with Microlight low-level laser. And he came out, showed me the unit, talked me through it, taught me how to use the laser, trained us up on that. Then started looking at some different things with that client. Prior to that time, I didn't do a lot of work on referral patterns or looking at sort of the myofascial trigger point component of rehab, and realized very quickly that this patient had a referral pattern coming from anterior tibialis. And so we put the low-level laser on that, chased it with a little bit of soft tissue work and kinesio taping. 3 sessions later, patient no longer had this referral or phantom pain that he was feeling in his second toe. So at that point, I was like, hey, what's going on with this laser? Mike said, keep it, try it for a month or two, and then see what's going on. So at that point, we put the low-level laser on just about everything that came into the clinic. Especially, I loved it on frozen shoulders, anything that was diagnosed plantar fasciitis that actually maybe looked a little bit more like a soleus, gastroc soleus trigger point. And then probably another one of our favorite diagnoses to put it on is anybody that's kind of got that acute muscle strain. If they've got an acute hamstring pull, an acute low back pain from working out in the yard, usually we put the laser on that very quickly. We get rapid results.
Now, Paul, how do you charge for the laser today?
Well, today we charge for it a lot differently than when we started. I was told initially from Mike that this is primarily seen. It's not reimbursed very well from insurance companies. But being a relatively new grad, new clinic, I'm like, well, hey, you know what? I'm gonna be successful at that, right? So we tried to charge for it through the insurance companies. We did that for about 6 to 8 months. After fighting with appeals processes and not getting the codes reimbursed, and then opting not to go back and chase the clients down for that, we took it as a learning experience and switched over to a cash program very shortly thereafter. We offer it in 2 ways with the cash program. The first and probably the most popular is an add-on, a wellness add-on or an elective service add-on to our current physical therapy clients. So they may be in for whatever the treatment may be. We'll say plantar fasciitis or a gastroc trigger point. So while we're doing other things, working on some of the strengthening, some of the neuromuscular techniques that we may be working with, if the patient elects to have to add the laser on,
and that costs how much?
We charge $15 for that.
Yep. Right, so add-on for $15.
Add-ons for $15. Our patients have been very pleased with it. We also try to set the stage for them right there, and not let them know exactly how many times we think it's gonna, they're gonna need it. That way, $15 over 3 sessions, over 6 sessions, most people are okay with that, and we just try to be upfront with that information.
Particularly if it works and gets them out of pain.
Absolutely, absolutely. And the other way that we do it is we will often have a lot of clients that they've tried other things before. They're not necessarily interested in physical therapy, or maybe they've been treated by a pain management physician for some time. And those guys may just come in and inquire about our low-level laser packages program. And then with those, we will do anywhere from a 3, 6, 9, all the way up to 12 visits packages.
And what do you charge for that, Paul?
Usually, our single session visit is about $79. After that, those packages get progressively cheaper. When you're up into the 9 and 12 range, you're paying about $30 per.
Yeah, do you have a little card that you give them?
I do. I sure do. One of the things we do for them to track that, it's a business card size card that they'll receive, and on the back of it, it's got a low-level laser or 830 laser treatment, and basically it's a punch card. So they come in, they'll pay for the package up front. We put their information on that card, and then we just punch that off every time. One thing that's important that we think about this, we actually keep this here in the clinic. We don't let the patients take it with them. That way they don't come in and say, hey, I've got a punch card, but I left it at home. So we manage that.
So it's part of their file, I guess.
Absolutely. We'll create a wellness chart for this client, and basically we keep this in there for them when they come in. That way we know what area we're trying to apply the laser to, as well as any other releases and things that we need in there. So.
And then on your website, you have, click here for a free laser treatment.
On there now, we have a click here for, actually we can do it phone consult, and they also have a coupon on there that gets anybody a free treatment. So current client, past client, someone that's looking to give us a test drive or a test spin, so to speak, they can click on that coupon, bring that in with them when they come in, and we'll give them a free trial.
Well, Paul, during the course of a week or so, or let's say a week and a month, how many patients would you see during the course of a week and maybe over a month that are paying cash for the laser?
Oh, goodness. That's a great question, Mike, and it made me think a little bit about that.
15, 20 patients a week?
It's probably more than that. We're probably right now seeing, most of our PT load, in which we see approximately 140 to 150 treatments per week. We're probably treating the laser on most of those, I'd say at least 50%.
Wow.
So that's 50, 60, 70 low-level laser applications per week is what we're typically seeing. Wow.
Well, yeah. Paul, anything that you'd like to share with other clinicians that are thinking about getting the laser and charging cash for it as we kind of wrap up here?
Well, I think it's an absolute. One of the things I've always learned or heard in the past is, learn from other people's mistakes. I was a little hesitant in doing that when I first found out about this device and best how to apply it, and as well as how to manage it from that business perspective. Coming from the clinician side primarily, and not necessarily a business person's mindset. And so for us, since we've made that change, oh my goodness, it's completely changed the cash flow in the clinic, as well as the outcomes that we see from the patients. I know a lot of people, when I hire new physical therapists, they don't know about this low-level laser either. And so they're like, Paul, what is this thing that you're trying to have me, put on these clients?
Right.
And so, same thing. I'm like, hey, take it home, try it on yourself, see what you've got, work through some other issues that they may have on themselves, and just give it a test run, and you will not be disappointed.
Right.
And we always give it up. It's even for our current clients. It's like, hey, we'll give you that free shot. Put it on them, run it for 8 to 10 minutes, whatever's indicated, and then at the end of that, they're usually saying, how do I get more?
Wow, what a great story. Well, Paul, thank you so much for your time, and we look forward to catching up with you again in the near future.
Absolutely.
Thank you.